The objective of this presentation is to explore the historic origins of Largo, Florida, and to analyze the holistic health of the community as it relates to community structure, population, demographics, services available, and health issues discovered. Pinellas County, a peninsula on the west coast of Florida, was originally inhabited by the indigenous Timucua Indians. The Timucua people were accomplished in agriculture, but were eventually decimated in the 1600s by Spanish explorers. Following this, the area was discovered again by the McKay brothers in 1843, who settled along now named McKay Creek, and they began utilization of the waterways for industries such as cattle, farming, lumber, citrus, and salt operations. Not long after, they were joined by a Captain Lowe, who set up an establishment called at the Largo Feed Store on the newly constructed railway, and these operations helped grow the economy. By 1860, the settlers built their first church, which was called Anona, and Anona School was constructed in 1870 to serve the growing population. These were the first schools and churches of Pinellas County to be built, and they both have experienced uninterrupted use to this day. The town of Largo was granted a charter by the state in 1905 and had great success in the citrus industry until the Depression and several hard freezes. Eventually, the landscape changed, and in the 1960s, we began to have more permanent housing tracts, and the population grew to over 20,000 by the 1970s. In Largo today, there are 39,000 households, and units include 23,000 owner-occupied and 16,000 renter-occupied units, with the average home value estimated around $150,000 to $200,000. With the average household income around $40,000, this leaves the hope of ownership out of reach for a substantial number of community members. Single-family homes, apartment buildings, mobile home parks, and condominium complexes are vast in their differences of values, yet general upkeep of properties is apparent, with the minority of rundown homes restricted to certain pockets of town and few vacant homes in the area. Section 8 public housing, called Rainbow Village, is located just north of Ulmerton Road, and there's currently a waiting list for placement. There are no homeless shelters operating in Largo, but neighboring cities of Clearwater and St. Pete have shelters that are activated during cold emergencies. There are several places of worship throughout the town, with many denominations represented. Many of these churches operate transport services for their parishioners that do not drive. During the windshield survey, it was observed that most roads are in good repair, with construction improvements occurring in several places of the city. Traffic congestion is an issue in this densely packed community, and the city encourages rideshare and the use of public transport. There are multiple pharmacies and grocery stores in the area, as well as large retailers such as Walmart and Target. There also are several privately owned smaller independent operations. There are numerous retailers and renters of durable medical equipment within city limits, offering products ranging from prosthetics to power-operated wheelchairs. Food for the poor can be obtained at Beacon Street Ministries, which operates a satellite food pantry in Largo. There are also thrift shops, which include Indian Rocks Christian Church Resale Store, Goodwill, and Christ Presbyterian Thrift Store. Currently, the estimate of population is just over 81,000. Over the last few years, the yearly average of births was 857 compared to 1,110 deaths. As previously mentioned, Largo citizens are packed in like sardines, with an average 4,407 people living within 1 square mile. For perspective, comparing to overall Florida density, which is 382 people per square mile. The median age is 49, and the median household income is between $38,000 and $40,000, with 19% of Largo residents living below the poverty level. 65% of the employed are in blue-collar fields, with 33% in white-collar. Service sector jobs are the most abundant, and the unemployment rate is around 6.5%, and the high school graduation rate is around 81%, which is pretty much on par for the rest of the state. But it has been found that overall in Florida, rates of graduation for non-whites are as much as 10 percentage points less than whites. Furthermore, the local fundamental high school boasts a 95% graduation rate, but this is a homogeneous student body of more affluent families, which highlights how inequity affects education. According to recent data, the leading killers in Largo are the same as national rates, with heart disease and cancer and a dead heat for top billing. Along with these, preventable causes of death such as unintentional injury are attributed to substance abuse, falls, and vehicular and recreational accidents. Top communicable diseases are monitored by the health department and include HIV and AIDS, chlamydia, and gonorrhea. Free HIV and AIDS and hepatitis C testing are available at the health department, as well as free seasonal flu vaccines in response to the number of positive flu cases this season. With the massive influx of out-of-towners and part-time residents, there is greater opportunity for spread of this virus. The local hospital has been inundated with flu-positive patients over the last 2 months and has experienced a large number of missed workdays and short staffing from the flu and other viral, respiratory, and GI ailments. Largo Medical Center is a for-profit teaching hospital specializing in adult and geriatric care. This hospital has a 425-bed capacity. Last year, there were almost 20,000 admissions with over 69,000 emergency room visits, and the cost of charity care delivered was over $24 million. There are several long-term care facilities in the area, including inpatient and outpatient rehab facilities, skilled nursing, independent and assisted living, and home health care agencies. For mental health services, there is an acute inpatient medical facility with Largo Medical Center, and that's for adults only. Adolescent crisis units are located in neighboring cities. Long-term inpatient facility is lacking in the immediate area, but there are several outpatient treatment facilities within the city. Pinellas County estimates that an estimated 16% of residents are unable to access health care, and they have established intervention plans for addressing this issue and how it pertains to the objectives framed by Healthy People 2020. As part of Pinellas County's goal to improve healthcare, they are hoping to decrease that 16% with local programs, including increasing the number of trained community health workers by 25% by the end of 2017. However, the numbers presently reflect these goals have not only been unmet, but are trending in the opposite direction. To reduce unintentional injury, they are teaming up with the Pinellas County Sheriff's Office to reduce fatal injuries on U.S. Highway 19, as this thoroughfare experiences the highest number of vehicular-related deaths in this area. Where they have made gains is in decreasing infant mortality and low birth weight rates among all ethnic groups across Pinellas County. Additionally, free vaccination for all children are available at the health department, with several free vaccines for adults as well. Water supply, sewage treatment, recycling, and refuse disposal for Largo residents is coordinated with the county and the city. Regular monitoring of water and air quality is done in conjunction with state environmental agencies, and according to the 2016 report, there were minimal pollutants and no deficiencies noted. Being such a densely populated area, with most of the area being developed, special consideration must be taken in managing the watershed and trying to minimize humans' impact on the environment. Many upgrades have taken place throughout the city's infrastructure and plant operations over the past year to address drainage problems within the city's sewer system. Recent significant rainfall events saw much improved conditions with decreased flooding and the avoidance of sewage spills. The McKay Creek watershed area receives special consideration in maintaining environmental integrity of the area, and the city aims to decrease its environmental imprint with integrating greener solutions for the future. The city's manager heads up the emergency management team during emergency, and together they designate action plans and coordinate among the divisions to carry out plans for response. They maintain an emergency operations command center at city offices on Highland Avenue and may regulate water services, impose curfews, prohibit price gouging, and ban the buying and selling of explosives, firearms, and alcohol. The county maintains authority over evac orders with a public urge to be aware of their designated zones. On the county website can be found lists of shelters, evacuation maps, supply lists, storm surge information, and applications to keep informed of potential emergencies with the area alert system. The command center also coordinates with the American Red Cross, Homeland Security, and FEMA. Evacuation routes, the major ones for destinations east include Park Boulevard, East Bay and West Bay Drive, and Elmerton Road. North and southbound major routes include Seminole Boulevard, Belcher, US Highway 19, and 66th Street North. As far as government and public policy, there is a publicly elected mayor and 6 commissioners whom operate within a city manager style of government. This city commission develops policy with help of advisory boards. The city commission is also described as being transparent and the Commission creates policy and has the authority to enact laws to carry out the duties of the city. Several advisory committees are in place and the public is welcome to join. Citizens are encouraged to attend meetings, which are publicly posted with the agendas advertised prior to any votes taking place. Legislative policies may be found on the city website and cover items including, but not limited to, filling office vacancies, impact fees, budgeting, and implementation of disaster planning. The vision for the city as well as the budget can be viewed on the city's website. The budget and fiscal proposals account for community needs as they pertain to public health and safety, infrastructure, economic development, sustainable growth, and adapting to environmental conditions. The mayor, city commissioners, and citywide planners has supplied an in-depth strategic outlook plan for the future with the goals working towards environmental and economic sustainability. The Downtown Redevelopment Project has several aims including establishing a vibrant mixed-use and mixed-income living community to offset needs for affordable housing and to improve housing conditions, to improve the access to city services, and also to increase access to arts and entertainment, all while adding beautification to the area. Population-based community health nursing recognizes the interconnectedness of many factors and understands how deficiencies in any area contributes to poorer health outcomes. Poverty is a significant detriment to health, impacts all other realms of a person's or population's well-being. Poverty can lead to inadequate preventative and primary care, as evidenced by $24 million in charity care delivered by the local hospital last year. Heart disease is the leading cause of death in the area, and the propensity to develop cardiac disease can be linked to risks associated with poverty, including unhealthy diets, increased stress, obesity from cheaper and processed foods. Poverty, in turn, can set the stage for substance abuse due to increased rates of mental health issues and lack of opportunity. This in turn leads to higher incidences of risky behaviors and communicable diseases such as HIV, AIDS, hepatitis C, and chlamydia. Poverty may also have an effect on how emergency operations are carried out in the event of an impending storm. As witnessed during Hurricane Irma, shelters in the area were beyond capacity with individuals that did not have the financial means to leave the area, many of whom were elderly and did not have the adequate support to safely allow them to weather the storm outside of shelters. The area was extremely fortunate that that storm experienced a significant downgrading prior to reaching us in the Largo area, as the 425-bed hospital had to evacuate higher floors due to window ratings, and many patients were transferred to a newly upgraded building, but that just so happens to be in a flood zone. Should the area be impacted by a powerful Category 3 or higher hurricane, it would be catastrophic.